Hi, Dr. Megan here with Twin City Health. So if you have found this video, then likely you are a pregnant mom or someone who is wanting to be pregnant and is looking for holistic support for that prenatal period. And we are going to discuss why pregnant moms get chiropractic adjustments, what those adjustments look like, as well as some other resources that can support your pregnancy and overall health for you and baby. So let's get started. So, what is going on physically in your body as you are growing a baby? So there is an amazingly magical hormone called relaxin that your body starts producing immediately that opens your joints. It relaxes all of the soft tissues, so those ligaments and tendons, to allow those joints to open up, grow, so that baby can grow more comfortably and so that they can descend and exit comfortably. But what happens sometimes is that because we can't just lay around and expand, we have to live our life and be upright and work and maybe take care of other kids. Sometimes our muscles tend to compensate for that relaxing to create more stability. And it's kind of a quick fix. The muscles sometimes overcompensate in more of like a fast, not super functional way. And we feel really tight. And those tight muscles can push on nerves, like the sciatic nerve is probably the most common, and create pain. Your center of gravity shifts forward as your baby grows forward away from your spine. And our abs actually start to separate when you are not pregnant. Your abs' main job is to hold you upright and support your low back. And as we are growing a baby, those abs separate, and their job is less focused on supporting your low back and more focused on getting ready to help your uterus push a baby out. So we've lost a little bit of support, everything's forward, and all of this creates that typical arch in the back that you see with pregnant women. Their tailbone sticks out and their belly's forward. And it can put a lot of pressure on your spine, hips, and pelvis. And then, you add the extra weight and it can be really uncomfortable. So the most common pregnancy discomforts that we see are low back pain. It affects probably most women. Sciatica, I wouldn't say affects most women, but a lot of women as early as the first trimester, again, because that relaxins on full blast, our muscles can really start tightening that early. But the good news is that typically I have seen the sciatic pain resolve sometimes in a couple of visits. So that's really cool. Hip pain and pelvic pressure, pubic bone pain can be really intense, especially towards that last trimester. Round ligament pain, the round ligament is a ligament that surrounds your uterus and gets really stretched during pregnancy and can also feel really tight and uncomfortable. Some other things that can be related to postural changes, are going to be headaches, maybe more related to hormones, nausea, and reflux is another really, really big one. That can be related to posture. That can be related to the rearranging of our organs as baby grows. And it could be related to hormones, all of the above. So that's what's kind of going on physically. And these are usually the symptoms that bring people in to get adjusted if they're not already getting adjusted prior to pregnancy. So those are reasons that people come in for chiropractic care. And really overall, moms who choose chiropractic care are looking for some sort of natural alternative to something, usually an alternative to pain medication, because we are really limited on the types of pain medication we can use during pregnancy. And some people just don't want to take medication at all and expose their baby to chemicals. So that's a big reason people come in for dealing with pain. And the cool thing is that these adjustments are so safe that there's no side effects for baby. Chiropractic adjustments have been scientifically proven to decrease labor times for up to 39%, especially in first-time moms, reduce the need for pain medication during labor, reduce the likelihood of postpartum depression, and offer a better environment for fetal positioning. And this all goes back to just chiropractic adjustments creating the right alignment so that baby and mom can grow most optimally. If we are in optimal position, then baby is much less likely to get stuck. And so labor is going to go a lot smoother. Overall wellness, chiropractic adjustments affect the central nervous system directly. So it can improve our anxiety, and thus improve our sleep and energy levels. But sleep might also be improved because of a decrease in pain from getting adjusted. So nausea can also be something that is addressed for some moms, not every mom, but adjustments have helped reduce nausea for some. And if you're in pain and adjustments help you get out of discomfort, then you're more likely to be able to stay as active as you want during pregnancy. At our office, we use a really gentle technique that is specifically designed for the pregnant pelvis. It's called Webster's Technique. All of our female doctors, all the doctors who you will be seeing during your pregnancy are Webster trained. And that's something that you can look up. We have specific tools for you to lay down and be comfortable throughout your entirety of your pregnancy. We have these pillows that have a nice cutout for your belly at each stage. And I swear most moms towards the end just come in for the pillows because they're tired of lying on their side. And it feels so good to lay face down. The Webster's technique is really specifically focused on each part of the pelvis that can become misaligned. And we check it every single time to make sure that all the checks and balances are there so that we can, again, create the most optimal room to support you and baby. You can definitely expect it to feel gentle. Most moms say it's very relaxing. And again, it's safe at any point in your pregnancy to start getting adjusted. Some things that you can do to really support your baby's development nutritionally and support yourself, because baby is taking a lot from your resources, are these foods that we've listed. The easiest thing to remember is eating the rainbow, trying to get as much variety as possible. For some moms, this is going to be really difficult because nausea and vomiting can be really apparent. And so don't be too hard on yourself if you feel like you can't eat any of these things. But if you can stomach them, organic leafy greens are a wonderful thing to include if you are prior to conception or in the beginning stage of pregnancy. They have folate in it, which helps develop the brain and spinal cord, as well as iron, which is going to help your blood supply and your energy. Wild caught salmon has omega-3s, which is helpful for baby's brain development, as well as, your skin. Our skin can get really dry throughout pregnancy, and that would be really supportive for you. Organic eggs have protein and choline, which is also really important for brain development, muscle development, organ development, all those things that your body's working so hard to create. We already talked about eating the rainbow. That's how you're going to get the most complete amount of nutrients. Bone broth is something that can be really calming on the stomach, but really nutrient dense and is really beneficial for growing, like you see on the side, joints and tissues. If you can stomach it, these are some really great supplements just to make sure that you're getting everything that you need and replenishing for you, mom, what baby is utilizing to continue to develop. So a high quality prenatal. What we mean by high quality, the number one thing that I look for in a prenatal is if it says it has methylfolate or methylated folate. And again, that's what's going to be developing first the brain and spinal cord. It's super important that we have folate, that we can absorb. A lot of vitamins will say folic acid, and that's synthetic. A lot of times our bodies can't actually utilize that. So methylfolate is the most bioavailable version of that vitamin. It's B9. Vitamin D is going to help support your immune system as well as baby's immune system and bone development. It's really common to feel like our immune system is weakened, especially in the first trimester and third trimester. So this one's a really good one. Omegas, great for brain development and eye development. Again, and for you, your skin and as well as those other things that it's supporting baby for will help you with too. Probiotics is a really big one. During your third trimester, you're going to get a GBS test, the Group B strep test. That is a strain of bacteria that can live in the vaginal canal. And it's something that we can actually negate or avoid by making sure that we have a healthy gut. And it's never too late to start working on consuming our probiotics. You can do it through foods, fermented foods like kefir or sauerkraut. But it's also nice to supplement just to make sure you have the biggest variety of probiotics to kill off the bad bacteria and replenish your gut with good bacteria. So hopefully you can have a negative test. And you'd want a negative test if you're trying to avoid, they're going to suggest taking an antibiotic during labor if you test positive for Group B strep. Magnesium is a magical thing. Towards the end of pregnancy, it's very, very common to have muscle cramps and have insomnia, not just because you're getting up to use the bathroom all the time, but our nervous system is just a little on edge. Our body's kind of preparing to not sleep for a while. And our mind can kind of race, but mostly those muscle cramps can be so intense and so consistent every night. Magnesium really helps soothe those. And it can help with constipation. So lots of great reasons for magnesium. Okay, so you might be interested in chiropractic care, but maybe your partner is a little concerned or you have concerned family members. And here are the facts. Chiropractic care, researched during pregnancy, it's so safe. You can start day one. A lot of times with massage, they won't see you until the second trimester, but you can start day one. Like I said, it's so safe. There's no increased risk when performed by trained professionals. So a chiropractor with Webster training. You want someone who's going to be really specific and knows what they're doing, which we do. So yeah, it's very safe. It's very gentle. It's very specific, and you can start whenever. It's also not too late to start. If you are 35 weeks and you just found out about chiropractic care, you just found out about us, come on. It's not too late and to reap some of the benefits from chiropractic adjustments. If you're wanting the most help in prepping for the rest of your pregnancy and labor. If you are pregnant and you have back pain, just know that there is hope. And if you're ready to address it and you want an alternative to medication, or the medication's not working for you, look at the link in our description, book a consultation with us. We will talk about your specific needs, a nutrition plan if you're looking for that. Our female doctors are the ones that are going to be seeing you throughout your pregnancy, and we love caring for pregnant moms and expecting and planning to be pregnant moms. We will help you create a wellness plan and help you feel prepared with resources for labor. Like I said, there's a link in the description. Here's the rest of our contact information, our phone number. I believe you can text that number. Where we're located, we're right off a main road. It's very easy to see. And our website, if you want to learn more about us, and you can book a consultation on that site as well. We hope to see you and care for you and your baby. And whether we meet you or not, good luck, and know that you are loved.